Alzheimer's disease is the most common cause of dementia in the UK. Dementia is the name for a group of symptoms associated with an ongoing decline of brain functioning. It can affect memory, thinking skills, and other mental abilities. The exact cause of Alzheimer's disease is not yet fully understood, although a number of things are thought to increase your risk of developing the condition. These include increasing age, a family history of the condition, untreated depression, although depression can also be one of the symptoms of Alzheimer's disease, lifestyle factors and conditions associated with cardiovascular disease. Read more about the causes of Alzheimer's disease. Signs and symptoms of Alzheimer's disease. Alzheimer's disease is a progressive condition, which means the symptoms develop gradually over many years and eventually become more severe. Affects multiple brain functions. The first sign of Alzheimer's disease is usually minor memory problems. For example, this could be forgetting about recent conversations or events, and forgetting the names of places and objects. As the condition develops, memory problems become more severe, and further symptoms can develop, such as confusion, disorientation, and getting lost in familiar places, difficulty planning or making decisions, problems with speech and language, problems moving around without assistance, or performing self-care tasks, behavior changes, such as becoming aggressive or suspicious of others, hallucinations, seeing or hearing things that are not there, and delusion, believing things that are untrue, low mood or anxiety. Read more about the symptoms of Alzheimer's disease. Who is affected? Alzheimer's disease is most common in people over the age of 65. The risk of Alzheimer's disease and other types of dementia increases with age, affecting an estimated 1 in 14 people over the age of 65 and 1 in every 6 people over the age of 80. But around 1 in every 13 people with Alzheimer's disease are under the age of 65. This is called early or young onset Alzheimer's disease. Getting a diagnosis as the symptoms of Alzheimer's disease progress slowly. It can be difficult to recognize that there's a problem. Many people feel that memory problems are simply a part of getting older. Also, the disease process itself may, but not always, prevent people recognizing changes in their memory. But Alzheimer's disease is not a normal part of the aging process. An accurate and timely diagnosis of Alzheimer's disease can give you the best chance to prepare and plan for the future, as well as receive any treatment or support that may help. If you're worried about your memory or think you may have dementia, it's a good idea to see a GP. If possible, someone who knows you well should be with you, as they can help describe any changes or problems they have noticed. If you're worried about someone else, encourage them to make an appointment and perhaps suggest that you go along with them. There's no single test that can be used to diagnose Alzheimer's disease, and it's important to remember that memory problems do not necessarily mean you have Alzheimer's disease. A GP will ask questions about any problems you're experiencing and may do some tests to rule out other conditions. If Alzheimer's disease is suspected, you may be referred to a specialist service to assess your symptoms in more detail. Organize further testing, such as brain scans if necessary. Create a treatment and care plan. Read more about diagnosing Alzheimer's disease. How Alzheimer's disease is treated. There's currently no cure for Alzheimer's disease, but medicines are available that can help relieve some of the symptoms. Various other types of support are also available to help people with Alzheimer's live as independently as possible, such as making changes to your home environment so it's easier to move around and remember daily tasks. Psychological treatments such as cognitive stimulation therapy may also be offered to help support your memory, problem-solving skills, and language ability. Read more about treating Alzheimer's disease. Outlook. People with Alzheimer's disease can live for several years after they start to develop symptoms, but this can vary considerably from person to person. Alzheimer's disease is a life-limiting illness. Although many people diagnosed with the condition will die from another cause, as Alzheimer's disease is a progressive neurological condition. It can cause problems with swallowing. This can lead to aspiration,
food being inhaled into the lungs,
which can cause frequent chest infections. It's also common for people with Alzheimer's disease to eventually have difficulty eating and have a reduced appetite. There's increasing awareness that people with Alzheimer's disease need palliative care. This includes support for families, as well as the person with Alzheimer's disease.